Well, good day, and I'm Ruth Bowick, and I'm welcoming viewers to our new series by Shaw Spotlight. It's called Healthcare for 55 Plus. Well, today my guest is Dr. Michelle Thomas, who is part of the Sunset Family Health Team. Now, this informative program is thanks to Shaw Spotlight, and I'm so pleased that Shaw, has invited me to be the interviewer with a number of professionals involved in pertinent healthcare for seniors. I will add that I'm positive everyone viewing this show, not only seniors, will glean a great deal of wonderful information on what the Sunset Family Health Team has to offer. We in the Kenora area are fortunate in being able to boast such a great plethora of informative guests to this show. So to get started, I am delighted to introduce and welcome Dr. Thomas.
Thanks, Ruth.
Okay, thank you. You're very welcome. Now I'm going to go into the first question I'd like to discuss, as I think personally, being senior myself and interviewing many seniors for other things, that I've noticed that there's sort of a danger for them taking over-the-counter medicines as opposed to prescribed medicines. Would you like to discuss that so that all of us seniors will understand what we should be aware of and what we should avoid and all that kind of stuff, okay?
So over-the-counter medications are things you could just walk into a pharmacy or a store and purchase without a prescription. So things like acetaminophen, also known as Tylenol, or ibuprofen, also known as Advil or Motrin. And there's also medications like Gravel and various other anti-allergy type medications, and a lot of herbal supplements and other medications. Many of these medications can be helpful to treat some of your symptoms, but there are harms associated with them. Particularly, you may find that a lot of the cough and cold medications have a combination of products with Tylenol and or Advil being in them, plus Benadryl or Gravel in these as components of the cough or cold medications. It's quite easy for seniors to take too much of those medications because it's very difficult to read the small print, particularly for seniors. And you can easily overdose on the amount of those medications. So that's always read the small print, even if it requires a magnifying glass.
Well, I'm sure they all have one now.
Caution with some of the over-the-counter sleep medications. Most of them contain Benadryl and Gravel, which can have some significant effects in their seniors because it can increase the risk for falls and for confusion, and that can lead to other medical problems, and it can also interact with some of their prescription medications, which is quite concerning.
But just for a second there, when you said for falls, does that mean you get some of these medications will make you a little dizzy, and then your bones, your old bones with a chance of breaking then?
Yep,
Thank
absolutely.
you. Okay, so you can
use them cautiously, for sure.
I never thought of that. That's why I wanted to clear it. Yes.
Yeah, and even some of the, like Advil, for example, or Aleve, used excessively, sometimes can cause stomach ulcers and bleeding in the stomach, and at any age, but we see it more commonly in our older folks because they're on other medications, or they might not be eating enough food or drink when they take these medications, so it can upset their stomachs more. And so any concerns that you might have bleeding or change in your bowels while taking those medications or an upset stomach needs to be taken quite seriously.
Okay. So some of those over-the-counter, then you slept it in there, affect your bowels so you could get diarrhea or constipation, something like that?
Yeah, sometimes.
Or as
absolutely.
opposed to your normal BM movement. Yeah.
So some of the medications might have what we call anticholinergic type effects, which is a type of medication that can has effects in many of our prescription and non-prescription medications that can cause constipation. It can make it difficult to pee. It can give you a dry mouth, and it can sometimes make you a bit confused as well. Yeah,
which not necessarily means dementia starting. It means just because of this medication, your mind is a little addled, like just until it works out of your system or something.
Absolutely.
Interesting. Very interesting. Yeah. So in comparison then with the prescribed medications.
So prescribed medications are ones that you would get from a physician or a nurse practitioner for an actual medical problem. So as we get older, though, we become more sensitive to the medications, and sometimes we need lower doses. And it's really important to review your medications regularly with your care provider to make sure that you're on the right dose for the right thing. And I find many seniors have been on many, many different medications for years without ever reviewing the indication for that medication. So there's a concept now that's very important called deprescribing, where actually maybe you don't need those medications because you no longer have that issue any longer. And is there a possibility that maybe the medication you're on, a lower dose might be just as effective? Which is important to review on a regular basis. And there's also some prescription medications that we are quite concerned about in our older folks, like narcotic or pain medications can be impact to seniors' health very much, cause some mental confusion sometimes, increase fall risks. So really reviewing the doses of those pain medications and if they're required and can the dose be decreased while still maintaining good pain control. And so reviewing that regularly is very important. The other class of medications that are very dangerous for our seniors it's a class of medication called Benzodiazepines. They are all the medications that end in PAM. So diazepam, lorazepam, clonazepam. Those medications are associated with a lot of addiction and tolerance and falls in our elderly, but also there's some new studies suggesting that they may be associated with increased risks of dementia with the use of this class of medication. And a lot of seniors use that to help them sleep. So those looking at trying to taper those medications and potentially try to stop, but don't stop them cold turkey, because stopping that class of medication just suddenly can actually induce seizures. So you must taper them down slowly with advice with your care provider. All right. And also other medications like diabetic meds, medications you should be reviewed regularly, because as you get older you don't want your blood sugars to be too low, because low blood sugars can also affect how your brain is functioning and lead to some confusion and maybe even falls as well. So making sure your diabetic blood values are at target and not getting the lows. And if that means taking fewer pills, even better. And same with blood pressure. You want to make sure that your blood pressure isn't too low, because that can be associated with falls. And just regularly reviewing what those indications are and what the proper dose would be. And if there are medications that you can get rid of, that you may no longer need.
And they're still sitting on the counter. And
they're expired.
I was going to say expiry date's long.
So if there are expired drugs, make sure you take them to the pharmacist, because they will dispose of them safely. Don't put them in the garbage or flush them down the toilet.
That would be the worst thing.
It's bad for the environment, absolutely. And there's also some really good studies out there saying that the more medications you're on, the more chance that these medications can interact with each other to cause adverse or bad health outcomes. So, and we see a lot of seniors that are on 5 or 9 or even more medications. I have seen that.
Yes.
And there's a good chance the more medications you're on, the more chance you're going to have drug-to-drug interactions that can actually impair your health and potentially lead you to have to go to the emergency room or be admitted to the hospital just because of the medications are interacting, causing you to be ill.
So that could be more hurtful than helpful, you see.
Yes.
But I'm thinking too that, do you think sometimes that senior citizens, they don't like to abuse privileges? Do you think they, even though they know they have all these medicines lined up and they don't have sure to take some or they should even take any, they're hesitant to bother the doctor?
They shouldn't be hesitant.
They shouldn't be. Well, that's good.
I would encourage them to
well,
please
that's what I want to stress.
I many times I have patients come in, just sweep the whole counter, put them all in a bag, and we'll sort them out here in the clinic and go through what you really need and what you really do not need and what you can get rid of, so that you can be healthy going forward.
Yes.
All right.
Well, I want to, does that fit into my next question? That was, some of these health issues that you just listed to me, can they, like I know seniors, being able to still drive at 80 and 85, if they're in good health and they pass the driver's test and everything, could some of these issues impact your ability to drive?
Health issues can impact your ability to drive at any age.
At any age, not
at
just...
any age.
Okay.
But seniors have a disproportionately more or an increased number of health problems that could impact their ability to drive. So physicians and all healthcare providers are required by law to report health issues that may impact driving to the Ministry of Transportation.
Oh, is
We're
that right?
mandated by law. We can't not report.
No, okay.
So we have to do that. But it's an awkward discussion to have.
I bet.
Because a lot of people don't want to lose those licenses.
Well, this is it. It's like losing some independence, you know. They, even if they don't want to, even or just want to drive to the grocery store or something, you know. If
so
they have to
my argument to that
what is your argument?
is that if your license is suspended or taken away for any length of time or permanently, it also, that door might close, but other doors are opened. So suddenly you have a large amount of money to spend because you don't have to worry about maintaining a car,
gas,
the insurance, the gas,
license plates,
the parking, you name it, right? It's quite a substantial amount of money. That pays for a lot of taxi drives, right? And people that don't drive tend to be more social. They pick up the phone, they talk to family and friends, and they engage more socially in that regard. And they start looking at different ways to get around. So
we do have a bus service here, you know.
Bus, or they start walking, which is
wonderful.
Which is great.
I bet you encourage that.
Yeah, so it increases social and physical activities.
Yeah, you bump into people. Just coming through this from here to the other end there, I bumped into a guy who wanted to know what I'm busy doing now, so I was telling him about this, and we just had a little bit of chat about it. And he was, I'm sure he was older than me, but he just said, like, you know, the best thing he can do is walk and bump into people like me and other friends that he hadn't seen for a while, you know.
So one door closes, but many other doors open up. But it's just getting around that change, right?
Exactly.
And that can be very difficult. And I often tell patients it's not a matter of if we lose our license. It's a matter of when. We all develop health problems at different points in our lifespan, and some of them just we can't drive because of how it impacts our skills.
And you don't want to take a chance of not only hurting yourself, say, but killing somebody.
Yeah.
And then, like, you know, can you imagine the consequence of that? You could end up in jail. You could lose your house, your money, you'd be lawsuited, and you know. Yeah.
And many people realize that they have their own health issues, and they voluntarily retire from driving. They realize, no, I'm ready. I don't feel comfortable anymore. I think my days are done with that.
Well, I actually had a friend that did just that. She gave up her car and because of health issues, and she phoned the taxi company here, and she made a deal with them that twice a week, one day they'd take her to the grocery store, and I don't know if they waited or she phoned them, because I don't think she was that age, she had a cell phone. Anyways, he would come back for her, take her home, and then another day she would maybe want to go to the mall or to Walmart or something, you know, or Canadian Tire. And they actually were good enough. Taxi drivers may hate me, but they were giving her kind of a deal. Yeah. You know, because it was 2 trips back and forth a week, and it was set, and the dates were set, and I think the taxi people appreciated it.
Yes, they do. Very much.
And then she never had to wait if it was a snow week or whatever. She never had to wait because her taxi wasn't available. Her taxi was there at the time.
That's a great example of how one door closes, another door will open up.
Yes. I know her, so I thought I might do that myself when I get to that point.
Absolutely.
Okay. Well, I'm going to go on to the next question that I do have for you. What can a person say, like me or anybody, me in this 55 plus bracket? Mind you, 55, you're not really that old anymore. Like 85, like me, I'm sort of like 75. So anyways, what could I do to prepare for a situation where I may not be able to make my own decisions about my health and my finances? Yeah. Especially my health. Finances, I just spend what I have.
So that's where we get into how important it is to have somebody designated as your power of attorney, both for your health care and for your finances. So that if you are not able to make those decisions in those realms of health care and finances, you have somebody that you trust and knows you that can make those decisions as you would if you could. Want
something done
and
or
so
not done.
Having that discussion with your person that you appoint to get that legalized is
Yes.
very, very important, because many people that I see unfortunately don't have power of attorneys in place, and they end up in a situation where they can't make their decisions, and their families are then required to do this. And some families are very understanding because they've had the conversations. It just hasn't been formalized in the legal POA contract. But other families are not so get along quite as
There's
well.
some fighting
And so
going
there's
on.
a lot of infighting, and that's where then the public guardian and trustee, which is a government agency, will actually step in and appoint somebody to be your guardian for healthcare decisions, or your trustee for financial decisions. And that might not be the person that you would want to make those decisions for you. So it is really important to have that sorted out early. In fact, anytime at any age it should be done, but particularly after the age of 50, is what they're saying. So even younger than what you said, at 55. So everyone should be doing that sooner than they think.
Later.
And everyone says, oh, I don't need to worry about it yet. And I always say, well, it's always too early until
you never
it's
know.
too
We
late,
don't know when we're
right?
going to be kicking the bucket and
It could happen
there
at any
somewhere,
point.
hopefully up there.
So it's and so that's really important thing to sort out to make it easier for your family down and for yourself as well.
And if you don't, then there will be the infighting. Like the oldest will say, "I'm the eldest, I should get this," and the youngest say, "Well, you know, I'm the middle child, I'm always neglected." You know, that's when the fighting starts.
Or if there's a blended family, it becomes even more complicated, right? So in the other part of that too is what we call advanced care planning, and that's not a legal thing, but that's to talk about your substitute decision maker. What are your wishes if you weren't able to communicate, you needed wanted a flu shot, let's say? Who would they know that you would want it or not? And that's one simple example, but it becomes more complicated. Would they know if you wanted IV antibiotics for pneumonia? Would they know if you wanted a blood transfusion, if you had a big bleed? And those types of healthcare decisions, which can change, and goals for healthcare can change over time, but that person should know what your plans are in advance of something happening. So having that documented is very helpful.
And then have everybody know where the document is too is just as important.
Yeah. So sometimes you can carry a little brief summary of that with your medications and your health problems on a little card pocket in your wallet, which can be very helpful.
Is all my children live away. One's in Toronto, one's in New York, one's in Boston. And one's in the BC. So what I did is when I had everything set, I emailed them each a copy so they know exactly. So they have it like in their hands now.
Yeah.
You know.
Yeah, that's excellent.
With them having to come here. You know, from far distances. I just feel it was the best thing that they knew exactly what I wanted before they even got here.
Absolutely. So that's being well prepared.
Oh yeah, I'm very well prepared. Sometimes I'm a little slow on, but that I want was just like you said, because I didn't want any fighting. Not that I expect my children. I have 3 daughters. Not that I expect them to fight. They all get along. But I just thought to avoid it.
Yes, absolutely. The lines are drawn.
Yeah, that's right.
Yeah.
They know what mommy wants. So,
absolutely.
And I'll be looking down. Listen, hopefully I'll be looking down to make sure they do what I wanted.
Important. So very important. Yes.
Yeah. So let's see. What else did I want to ask you? I know I did want to go into this a little bit about. I didn't know that you were the medical director of Pinecrest Home.
Yeah.
When did that take place?
So I've been the medical director there for about 5 years now.
Oh, really?
Yeah.
Okay, I didn't know that you were even involved in Pinecrest.
So
tell me a little bit about that. So would you also go as the physician to check the patient as well as the director?
I have about 50 patients in Pinecrest.
You don't do the whole home?
I don't do the whole home. Just because I thought it would be better for a group of physicians to rotate. So if I'm not available, I'm off on holidays, there's somebody else that's familiar with the building and the systems there that could cover us. So currently there's there's three of us. There's myself, then Dr. Shannon Weeb, and Dr. Carrie Anderson.
Okay.
Then we also have a nurse practitioner that works
Nice.
full
Aren't those
time
nurse
at
practitioners helpful? They're so
Pinecrest.
helpful.
Yeah, so very good. His name is Mike Limerick. And
I know Mike.
Yeah, he's quite
He was
involved
my
with
neighbor
the-
for years on 4th Street North when he was little.
Yeah.
Now I'm older and he's getting, here he is already a nurse practitioner, yeah.
Yeah, so and he runs a lot of our programs there, and he's also quite involved with the Kenora Area Palliative Health Group.
Oh, okay.
So he works a lot with palliative care in our community, as well as Pinecrest and Birchwood. he works at too.
Do you do both two or you just
No, I just do Pinecrest, but Mike works
Birchwood
at both.
Okay, as a nurse
Birchwood and-
practitioner. Okay.
Yeah, absolutely.
That's great. Yeah.
Yeah.
So, what's this? You gave me something about this SCFHT board. You're the chair of that.
That's the Sunset Country Family Health.
Oh, that's
team.
this team we're at. Oh, this okay.
It's the
You're chair of-
whole
they actually
team.
have a board.
We have a
Oh, okay.
board, yeah, and so we've been working hard in the last year to restructure and make it more community-based and skills-based. So we are changing the composition of that board going forward. But
because I just got a notice not long ago from Dr. Michael Christian, my dentist, that I guess he wasn't part of this family health team, but he is now. That's what the letter from him said.
Oh, okay.
I didn't know that he wasn't. I thought just because
Yeah.
he was here, he already. So you have to like be invited or apply or.
It's part of the comprehensive care.
Excuse me.
Yeah.
So I got a few allergies.
No, that's
Spring's
okay.
coming.
That's good that spring's coming. 6
I
months
know.
of winter.
So
is
nice to see the snow and everything finally gone. Oh my goodness. Although
So-
I heard on the excuse me, just I hate, but I think we're going to get a snowfall either Thursday or Friday. 10 to 15 centimeters, you said, but that's hopefully the wrong. Anyways, I interrupted there about the snow.
No, I was also going to say, as part of our family health team, we've also expanded into a nurse practitioner-led clinic.
Oh, really?
So we've got funding as of this last year, to do an independent nurse practitioner clinic. So they'll be accepting patients into their practices, and currently there's 2 nurse practitioners, but there'll be a third one. And they're taking names of people that don't have primary care providers right now.
Wonderful news.
Off of the Healthcare Connect list. So it's really important, if you don't have a physician or a nurse practitioner looking after your health right now, please get on the Healthcare Connect and register for that, because those nurse practitioners will be taking names off of that list to incorporate into their practice. And we also have 3 new young physicians in our clinic here. There's Dr. Greck, who took over Dr. Beveridge's practice, and Dr. Isaacson, who took over Dr. Retson's practice.
Oh, yeah. Julie?
And Dr. Emily Drake will be taking over Dr. Lass's patients.
Wow.
But they will also be accepting new patients to boost up their numbers eventually. So that's good news for
It is,
Kenora.
but the good news is going to be, because you're going to give them, we've got about a few seconds left. Could you give them like the phone number, how they can connect with this Connect?
So I don't have a phone number, but it's a website. You just go to the Government of Ontario Healthcare Connect. You can Google it, and it's the first thing that comes up.
Okay.
And there's forms that you can fill out and submit.
Okay, well that's good, because we have to let them know how to get involved.
Yes. And I feel bad saying go to the internet, because probably might be easier to phone, but it is through.
Well, they probably have children or grandchildren that'll help them to get on the internet.
Yeah,
but it's amazing how many people now are seniors. We've got an internet program down our New Horizons, and the lineup is signed up, and they're so they can do the basics, so they can do that. Yeah.
Perfect.
Well, listen, Dr. Toz, I really want to thank you. It's just been such an educational thing for me to interview, and I'm sure all the viewers on Spotlight, Shaw Cable Spotlight Channel 10, when it starts to air, will be just as in and be just really exciting to hear what you've had to say. So thank you so much, and thanks again, Spotlight. But I shall return. I still have some more interviews to do.